All right. If you're enjoying our playlist, check out Data Nova on Spotify, where you can enjoy all sorts of space and star-themed music. Next up, we have the first session of a two-part series called Data Pandemic. The point of these talks is to hear from companies that are doing something unique with their data strategy in response to COVID-19. When the world went digital overnight, many companies were flat on their heels, not having easy access to newer data to harness newer behavioral patterns in their analytics. These talks address the impact of data strategy resulting from the massive shift in the way we all live and work. We have an exceptional moderator to lead us through these discussions, and I'll turn it over to Tony Baer to introduce himself and get started.
Okay, thanks, Jess, and good day to all of you. Thank you for taking time out of your day for joining us in this session, one of several sessions where we're going to be talking about arguably or inarguably probably the chief issue facing us in the data world, which is basically data and the pandemic. This is literally a life or death issue. And over the next half hour, we're going to be basically speaking with the leader of a healthcare solutions provider, a healthcare giver, and a provider of data governance solutions. Without much further ado, I'd like to introduce the members of our panel. We'll start off with Richard Jarvis. He's the Chief Analytics Officer at MS Health. He's currently a technology and analytics leader. He mentors and directs large international teams with advanced solutions in the healthcare area. And his experience actually spans several sectors beyond healthcare. But prior to this, he's been involved with telecoms and law enforcement and cybersecurity domains. Joining him will be one of his firm's customers, Mark Selman, who is CIO for Frimley Health and Care ICS, which is located in southern England. And also joining us on the panel is an old friend, Syed Mahmood, who's head of product marketing at Privacera. Privacera is a centralized data access governance platform. It's based on the open source project Apache Ranger. I knew Syed from his days at Hortonworks, where his company was involved in leading that open source project. So without much further ado, I'd like to turn the session over to Richard.
Thanks, Tony. I mean, the pandemic really has affected our business in a number of ways. The healthcare world has had to move to doing things remotely very quickly and to assessing data that's coming in from an ever-changing environment, which is very sensitive data in many cases, but needs to be used by lots of different settings so that we can provide the best care to patients, keeping them safe while respecting their privacy. EMIS covers a wide variety of different healthcare settings, all of which get touched by the pandemic in different ways, from GP systems where patients might visit their doctors with symptoms, all the way through pharmacies providing medications to patients, community and mental health care systems, which are also affected by the pandemic, and all the way through to an app that we run, which allows people to record their symptoms, provide information for research, and so on. So all of those systems get affected when a pandemic hits. And what we've been building actually from some time before COVID-19 came along is an analytics platform that allows our customers to better understand their patients and what's going on in their populations, so that they can provide the best care to patients. And really that's what we're all about. We only provide the software, and we work with our customers to provide the care. And they use our data in a variety of different ways to gain insights as to how to offer the services best. And actually, it's really my pleasure to talk with Mark here about some of the things he's used our platform for. And I'll maybe just quickly show you a slide and turn over to Mark to talk through some of the insights he's been able to gain using analytics during this COVID crisis.
Thanks, Richard. And I think one of the things we've struggled with as a national health service, a region that delivers sort of, health and care with its partners for our populations around 800,000, is that all the data is sat in silos, and it's been highly challenging to access that with anything that could be deemed sort of modern, and be able to bridge that to understand the holistic needs of our residents. There have been some quite high-profile examples of quite important systems falling over because they relied on spreadsheets. So when Richard and colleagues showed us the sort of the EMIS XA platform, we were hugely interested and excited about it, because it really has liberated some of the data that has sat historically in one of those silos. And as Richard said, highly sensitive, highly contemporaneous, but hugely important for understanding our population. And if I just sort of touch on two examples, one, we've had to respond really quickly to the emerging COVID situation. What type of people were catching it, what was happening with transmission, what was happening with the severity of the people that were catching COVID, so that we could support public health initiatives to try and drive home some really key messages to our residents, as well as soon as we knew that someone had tested positive, what interventions were available to us that could try and prevent an exacerbation, a hospital stay, and having this primary care data in an incredibly well structured way that we're able to interrogate has been integral to that COVID response. In addition to that, and what this slide really touches on, is that we can start to really dive into detail that we've never been able to before, about understanding the sort of provision of healthcare, which we started to really understand better, but also the needs of our population. So, you know, using EMIS XA, we've been able to really delve into how different configurations of primary care, which we have in our local system, are delivering care. Is it predominantly GP-led, nurse-led? Do they have pharmacists? The green sort of bars on the right-hand side indicate how our patients are using services, broken down by the conditions that they have. So we can see that people that have hypertension or depression are significantly more likely to need primary care activity, and we're able to have conversations with our primary care colleagues to look at how do we match the staffing levels we have with that clearly visualized need. And this is hugely important as we start to emerge from COVID. We've had to redeploy local resources to vaccinations, to the urgent COVID response, but that has led to a drop in the provision for some of these conditions. So we can't just start again in March, April, and do everything like we always have done. We need to use data better. We need to look at more virtual, more remote, as well as empowering our patients to look after themselves. So that ecosystem of apps, of other components are going to be hugely important. So although highly challenging, highly stressful, we're still in it. Tools like this are a bit of a light at the end of the tunnel.
Thanks, Mark. Tony, back to you.
Okay. Thank you. Thank you, Richard. Thank you, Mark. Richard, I have a follow-up question here, which is that, and Mark was talking about basically, tracking patient populations. Yet, of course, if there's any one area, domain of data where privacy is really paramount, it's in health records data. And so even though I'm sure that you basically anonymize data, how do you deal with basically concerns that data that once it's been anonymized, when you start looking at populations, can be de-anonymized? And how do you basically ensure that data stays private as it's supposed to be?
Yeah, it's a great question. And really, there's two parts to it. I think initially, people are actually quite altruistic in COVID. We run a survey where people can contribute their symptoms and how they're feeling on a day-by-day basis to a research team. The patients are not paid for that information. They don't benefit in any way from it, other than by giving that information, we combat together the problems that COVID caused. So patients are happy to share their information. So I think that's one interesting outcome from COVID. If people feel it's useful to healthcare, people are very happy to share. Obviously, it has to be treated sensitively, and we have to put the right controls around it. But people are happy to share. As to how do you kind of keep the anonymity, really, there's two parts to that. Security, making sure that people who have access are the only people who have access, and that no one is able to compromise your security. And anonymization. And anonymization is much more complicated than just replacing email addresses with random strings of text, because you have to look at very low numbers. Very rare diseases might only have several cases in the whole country, and so it doesn't matter that you've anonymized the names. You'll be able to de-anonymize that by using other data sources. And there we have a selection of very capable technology coupled with ethics and data governance policies, which mean that we suppress low numbers of patients, and we consider all of these risks ahead of sharing the data. But it's much more complicated than people begin or realize when they begin.
I'm sure it is. Thanks, Richard. I'd like to, at this point, shift over to Syed over at Privacera. This is a company which is basically, putting together a more horizontal solution. Syed, can you take the mic?
So thank you, Tony. Thank you, Richard. Great presentation. And it's my absolute pleasure to be speaking with you as part of a great lineup of Data Nova speakers. As Tony mentioned, Privacera is a provider of a centralized data governance platform that provides consistent access control across cloud services. And as Tony mentioned, I'm part of the product marketing team at Privacera. So as Richard mentioned, essentially COVID-19 has turned every aspect of our lives upside down. And it has also highlighted the role of data in governments and national health organizations' efforts to combat emergencies and the spread of the disease. So if you think about all the protocols that we are following as part of this pandemic, such as social distancing, travel bans, school closures, and quarantines, these are all driven by data and analytics. And this is an illustration from Deloitte that talks about lessons that COVID-19 has taught us. And the biggest epiphany for me is that COVID has turned governments and national health organizations into stewards of public data. So you'll notice how similar these lessons are to some of the practices that we have been trying to implement in our own organizations. So let's start out with effective data governance being critical in this scenario. And this may sound obvious to data practitioners like us, but government agencies now more than ever need effective frameworks and data governance platforms to ensure that data is only being accessed by authorized personnel and for intended purposes, to ensure that data is being used for ethical purposes. So just like when we build databases or data lakes in our organizations, data security and privacy is one of the primary design considerations. The challenge now is how do you extract insights and build models using personal and regulated data? And that's where Tony, you mentioned earlier data anonymization techniques such as encryption, data masking, filtering can help to use that data while still protecting the identity and privacy of the individuals. Moving on to the data sharing enables innovation. Just like we have been trying to democratize data in our own companies and organizations because we believe that this will spur innovation. Now COVID has forced governments to share data across borders so that researchers can collaborate and come up with viable solutions. And this again raises the importance of making standardized data securely available to researchers worldwide. And finally, we cannot derive any meaningful results from data unless the data itself is reliable. In order to identify issues with data, it must go through a data discovery process to identify missing fields and sensitive data. And data stewards at national health organizations and agencies need to classify data, identify problematic areas, and tag data that can introduce bias into the analysis. So this is a framework that we have used to explain the roles different teams play in an organization to implement effective data security and governance. So on the left-hand side are the departments and of Chief Data Officer, Chief Privacy Officer, and CISOs who are writing corporate policies with regards to data access. So they are essentially defining the controls on data. While on the right-hand side are consumers of data. So these are your data scientists and analysts who would like to have as much access to data as possible and as quickly as possible in order to do their jobs. So the burden of implementing these access policies and then providing authorized access to users fall on the shoulders of data infrastructure teams that are represented in the IT organizations that are represented in the middle of this slide. So we see these teams that are caught between an organization's need to secure and protect its data versus making data easily accessible to as many data consumers as possible. And we believe that this pandemic has tipped the balance of power slightly to the right-hand side, where the need to collect and analyze data related to COVID may have taken priority over the application of data governance and access controls. So we feel that public cloud providers and native cloud services can play a major role during times of emergencies and pandemics to share and analyze data quickly. Cloud provides companies with the flexibility to instantly provision storage and compute resources and subscribe to cloud native services that best suited for their use cases, and then essentially decommission these resources when the task is completed. Data scientists and analysts extensively use cloud native services like Databricks, Spark, and Snowflake. And this model can work very well during emergencies when there is no time to build data infrastructure and where data from a national or potentially international sources can flow into a cloud repository that can scale up as the volume of data grows, and where data analysts and scientists can work off of the same master data collectively and collaboratively. But cloud is not without its share of problems. Public cloud providers and third-party cloud services like Databricks, Snowflake, they all provide their unique mechanisms for managing users' access to data. And what this means is that data administrators have to become well-versed in administrating access controls for a growing number of services. And they have to navigate to multiple interfaces to do so. And this can impact users who expect to access data in multiple services quickly and at high concurrency. So the onboarding process for users must be easy to request access, yet scalable for administrators. In order for the users to find value in the platform, in the data platform, they must be able to access their data quickly with the required privileges. If the onboarding process is manual or overbearing, data scientists, analysts, and data users are unlikely to engage with the system. So what capabilities do organizations need to deal with some of the challenges that I mentioned earlier? We believe that the journey to effective data governance during normal or extraordinary times begins with data discovery and the ability to identify and classify sensitive elements in your data. This enables organizations to apply tags to their data, and think of these tags just like the tags that are applied to luggage by airlines to keep track of them. But more importantly, government agencies and organizations can use these tags to build policies and rules about who can access what data and which data sets contain private or personally identifiable information. And after you have classified your data, now you're in a position to build access control policies to secure that data. And at this point, you need a centralized platform that provides fine-grained access control to create role, attribute, or tag-based policies at file, row, or column levels. So this is critical because the richer the access control platform's ability to administer policies to finer grains of data, the easier it is for the infrastructure administrators to grant access to the precise slice of data that users need to do their jobs. If your data is spread across on-premises repositories and cloud services, then you will need a data governance platform that provides native embedded connectors across hybrid architecture to administer consistent access control. And finally, you need the ability to protect data while it is at rest or in motion by encrypting it as well as mask or filter it so that you can make regulated data available to your data consumers. And you need visibility throughout this process with rich reporting and the ability to audit who accessed what data, when, and whether this access was granted or denied. So this was a lightning fast overview of some of the lessons that COVID has taught us and what capabilities are needed to help us make decisions grounded in trusted data that are required during emergencies and crises. So I would like to thank you for your time and invite us to visit at privacera.com. Over to you, Tony.
Okay, thank you, Syed. Both of you mentioned some very interesting issues. Syed, you've mentioned this essentially that the pandemic has shifted the balance of power from those who seek to, from the data stewards to data consumers. Yet at the same time, Richard, you've also mentioned that the pandemic in a way has kind of made certain tasks easier with regard to that consumers, or in this case, patients, are more willing to share their data based on a common, shared, desired, shared goal for having research to, so that we can solve this pandemic. That being said, how do we basically, again, we're in an unusual situation now. Maybe this might become the new norm, but either way, how do we square basically this? I mean, obviously, the fact that patients are more willing to share data does not mean that we can afford to ignore patient privacy. So how do we basically in an era where we need to really ramp up our research and be more data intensive, basically able to square essentially the kind of like conflicting forces of the need for greater scrutiny on data protection and privacy versus the need for more ready access. Richard, I'd like to start with you, and then Syed, I'd love for you to respond, for you to follow up.
So, I mean, from my point of view, I think process, when a crisis hits, you fall back on your processes, you don't ignore them. And actually in healthcare for a long time, because as you point out, the data is very sensitive, we've had really good processes. Sometimes they don't go as quickly as we'd like. And I suppose like in many industries, COVID has put the pressure on trimming out like wasted time in processes of handing over between different teams and so on. And I think we've definitely got that faster than we might have done in the past. But what we absolutely have not done is try to bypass any processes. We need to fall back on them and rely that that is the right process. We follow it through, we do it as quickly as we can, but we know that once we've got to the end of it, we've done the right thing, we've done it safely. Technology definitely plays a part here. If you, as Saeed says, if you've got the right kind of tools where people can see the rules, they can update them, and then they can be applied across your entire data set, that makes it easier. But I think any good business is set up with the right processes that can scale in the time of a crisis, or when hopefully life goes back to normal.
Just would like to add, so Tony, you're absolutely right. I think it's a constant challenge to balance the personal privacy of citizens with the need to control the spread of the disease. And what we have seen is, again, if you have good access controls in place, that are very helpful, as Richard mentioned. But in these times, we have also seen certain temporary waivers being applied to certain processes. And I'll give you an example of GDPR, right? So, for example, in GDPR, the right to give consent and right to erasure. These are all, foundational elements or provisions of that act. So, but in what COVID has forced us is, how do you get consent from a person who is not in a position to give consent, right? So these are all the various considerations. And I think when the pandemic is going to be over, we'll have to go back and audit, do a really good job of auditing and taking a look at our processes and to see whether they have stood up during this pandemic, and determine who was able to access what data and for what purpose, and whether it was ethically accessed or not.
One final question, and I'd like to ask both of you, which is that we've always had data silos, but in the cloud we just have even more data silos. So how do we have to adapt our practices and our tools to adapt to the cloud?
I can go first on this one. Because as I mentioned in my presentation, cloud is when you essentially subscribe to a cloud, you decide to migrate to the cloud. You are not migrating to quote unquote one cloud. You're subscribing to a number of these services, right? And each of these services have their own mechanism for administrating security and governance. And that makes the process of administrating and authorizing users access very difficult for administrators. So what the approach that we have come up with is to have a centralized data access platform that enables users to administer security from one place, from one centralized place. So the probability of making errors or the need to navigate to multiple interfaces is greatly reduced. So if you can place a platform in the middle between the services that you're trying to access and the user and the administrator, that makes things a little bit easier.
And this pretty much wraps up our time for today. Anyway, I would like to thank Richard Jarvis, Mark Selman, and Syed for joining us in this discussion. As I said, basically, there's no problem that in the data space that's more pressing today than dealing with the pandemic. And in turn, the pandemic is solving this pandemic is going to require data. And obviously, this is not the last word on the topic. It's a good opening shot. We'll be returning to this in follow-up sessions here. Anyway, I'd like to thank you very much for joining us today.